Hello everyone, hopes all of you are fine. In this lecture, we will study about physiotherapy care for ICU patients. ICU patients means that patients which are in intensive care unit. Okay. Now we will first of all judge or check the variant systems of the body of the patients who are in ICU. We will check for musculoskeletal assessment of patient, neurological assessment, cardiovascular assessment. We will perform renal assessment of the patient, respiratory assessment of the patient, immunological assessment and gastrointestinal system assessment of the patient. Okay, all of these assessment of the patient will be performed in ICU care unit. So now we will one by one study how we will assess all of these systems of the patient in the ICU. First of all, we will discuss about musculoskeletal assessment. We will first of all perform musculoskeletal assessment. Okay, in musculoskeletal assessment we will change the position of the patient. Okay, if the patient's condition becomes worse on changing the position, then patient has any musculoskeletal issue. Next is neurological assessment. In neurological assessment, we will calculate GCS score of the patient. GCS score is Glasgow Coma scale. Then we will check the pupil size of the patient, whether the pupil is dilated or not, whether the intracranial pressure of patient is raised or not. Okay, and we will measure the ICP pressure of the patient by different devices, because direct brain death can occur if the intracranial pressure fluctuates during exercises, and exercise is contraindicated when the patient's intracranial pressure is not stable, because it can lead to brain death. Next is cardiovascular assessment. In cardiovascular assessment, we will check the heart rate of patient, blood pressure of patient. We will check for arrhythmia. High blood pressure is always a contraindication to exercise. To check deep vein thrombosis, we will check the ultrasound of the patients. In unconscious patients and in conscious patients, we can check Hoffman test. Hoffman test is patient has pain on squeezing the calf muscles. Next, we will perform respiratory assessment. In respiratory assessment, we will check ABGs, arterial blood gases concentration, auscultation, percussion. For renal assessment, we will check the capacity of the patient to do exercise, history, renal test, edema, check for edema. Okay, check for infection, proteinuria and hematuria. In immunological assessment, we will check check for the safety of the patient. Okay, in GIT system, we will check for constipation, because constipation is major issues in bedridden patients, and for this we will perform abdominal kneading. That was all about our lecture. Thank you for watching my video.